So just firstly, delighted to be here. I've spent 25 years in the NHS and I have absolutely no regret in joining the NHS and choosing to have my career here. So what I'm going to talk you through is the Northern Care Alliance, and for you to encourage you to think of us as an employer. But most importantly, what I'm going to talk through is it's really important in your career that you find the organisation which fits with your values and beliefs and find a place where you belong. Don't change to fit into an organisation. The health and social care organisations come in all different shapes and forms, and find the one that works for you, because every pan has its lid. So the Northern Care Alliance is born out of Salford Royal Foundation Trust, which is an outstanding organisation, integrated care organisation, that was asked to step in to support Pennine in 2016, led by Sir David Dalton. So previous to this, David had written a report looking into the governance and organisational structures of large-scale NHS organisations. And what that report found was, in becoming big, we had lost some of the connectivity to our local communities. That large organisations who work on a centralised command and control weren't agile enough or had that connectivity to those local communities. So what the Northern Care Alliance is, it is a group of hospitals and community and integrated services that works together through an alliance. So it's a novel-based organisation form with highly integrated health and social care. We kind of cover the northern arc of Greater Manchester, so we're in the devolved authority of Greater Manchester. This is just some quick facts that you can read at your leisure. We're big, so it's 19,500 staff, over £1 billion of purchasing power. We are brought together through the vision of saving lives, improving lives, which bounds what we do. I'll just pull out two bits, really just for time. We're highly reliable. So it is about making sure that we've got consistent, high quality care, regardless of your place, be that a hospital or in someone's home or the time of day. But importantly, we are connected to our local communities. So just to emphasise, we're not just hospitals. We work in an integrated partnership model. It is different in each of the localities that we serve. So in Salford, which has got a strong history of integration, social workers, for example, are employed through the NCA and work in an integrated way. Whereas in Oldham, we've got an alliance of providers where we're one of about 4 providers that have all working together to develop integrated care. So integration of health and social care, probably the easiest way to describe this is just as a story that really comes to my mind. I sat with a really lovely gentleman who had been married for over 50 years, and he talked about the care that his wife received at her end of life. He was full of praise for the compassion and empathy of the staff that went in and supported him. But he said he had about 7 different teams went in during her last 10 days of life. And he had absolutely no idea what they were all doing in terms of how they related to each other. And his only regret was that he spent too much time talking to teams about what each other were doing rather than holding his wife's hands. So for me, integrated services is to avoid that duplication, to make sure that we are going in a much more person-centred way, wrapping around care in the community. I'm very conscious of time, so just to whiz through why I come and work for Northern Care Alliance. Firstly, I joined the health service because I want to make a difference. I want to make a difference to lives, but also to communities. The Salford Royal, which was the foundation of Northern Care Alliance, has built its history on continuous improvement. So we've really democratised management of change. Any staff member can be involved in a change project, and that's the culture of change and improvement is throughout the organisation. It's a place that looks after its own, I think more so than ever, given the current challenges with COVID, is about how we support our staff. There's really clear research evidence that compassionate, well-organised, well-respected teams give better care. So we have got a really strong health and wellbeing offer, which you can see through the website. And perhaps for number 4, it's the place where the sky's the limit. Because of our size, we can take staff who may come in as a healthcare assistant, support you through an associate nurse path, maybe even into a registrant and into a registered nurse profession, and we can support you all the way up to becoming a chief nurse. The economies of scale means we cover pretty much every discipline, from health, social care, community, and into tertiary services. So why are we different? Just to end. So we kind of know that the area that we serve isn't currently doesn't come off well by our current economic model. We know COVID as a disease has disproportionately impacted on elderly and those from BME communities and those in low-income households. It's exposed what we already knew, that health inequalities is really out there, and we have real divisions within some of our localities of a difference of about 10 years life expectancies within about 6 miles. So it's the NCA's belief, and kind of my job, which is to think about how do we play a more active role in tackling poverty, which fundamentally is one of the underpinning causes of ill health. So we've created what we're calling our anchor mission. So that's based on the concept of anchor institutions. So these are large organisations that, alongside their main function, also provide a significant and recognised role in the locality to shape the economy. In all of the localities that we serve, we are the biggest employer. So what I show in this slide is what we're doing around supporting our place, particularly in terms of pulling people who are furthest away from employment into our organisation. By 2025, half of our workforce will come directly from within the catchment area. We're looking at where do we spend our money so that we are increasingly spending more money from within our local community, and that we're using this in order to help influence NHS policy working forward. And there is some further information you can get online, the NCA job Twitter handle, and then my contact details and mobile number if you want to continue this conversation.